All right, Miss Carrie, go ahead and take it away.
All right, good evening, and thank you for joining us today. For the purpose of reviewing later, this webinar will be recorded. My name is Lisa.Kerry, and I'm from Chesapeake Public Schools Office of Family and Community Engagement. Tonight, I have the pleasure of introducing the following experts for our Child Care Forum. From Chesapeake Public Schools, I have my partner, Leonis Brown. She's also a Family and Community Engagement Specialist. Elena Trott, Director of Strategic Planning and Partnerships. Andrea Vale, Chesapeake Education Foundation Administrator. Jackie Tate, Director of Elementary Teaching and Learning. And Dr. Angie Isbell, Director of Title I. From Chesapeake Programs, I have Catherine Jesse, Senior Community Program Specialist, Chesapeake Human Services. I have Linda Ross, Child Care Program Supervisor, Chesapeake Department of Human Services. Emily Edmonds, Early Childhood Program Coordinator. And additionally, I have Patricia Myers, Licensing Administrator, Division of Licensing Programs, Eastern Regional Office of the Virginia Department of Social Services. I also have Lisa Engel, an epidemiologist, that's a mouthful too, from Chesapeake Health Department. Yvette Anderson, who's the director of Right Start Early Childhood Center, and Annette Georges, administrator and director of Apostle Preschool and Child Care. So thank you all for attending. Before we begin, I would like to just express my gratitude for our essential workers who have provided services in a variety of capacities during COVID, particularly our child care providers who have consistently provided love and care for our students during this time. Chesapeake Public Schools and the community truly understands that this has been a difficult time for all of us globally. We all had to reach beyond our comfort levels to prepare and strategize to find unique ways of working, communicating, and educating one another during this crisis. And for that reason, Chesapeake Public Schools, the Office of Family and Community Engagement, Chesapeake Human Services, the Virginia Department of Social Services, and the Health Department all stand and support you during this transition. We hope this information and future webinars will be able to continue to build a sense of community between us and you. The purpose of tonight's forum is to provide you information regarding basic child care needs as it relates to applying, licensing, learning, and health and safety guidelines, particularly as it relates to this pandemic. If at any point during the presentation you have a question, Catherine Jesse will check our Q&A box, and we will also have pulse checks throughout our presentation. Our first question deals with enrollment. Emily, I'd like to ask you, is it too late to enroll my child in childcare?
No, it's not too late. One thing with enrollment is it's center specific. So when you are contacting centers looking for childcare, you can ask them. A lot of places are still have spaces that are available. And one source that you can utilize is Childcare Aware. The number, we'll try to put that in the chat section, but you can dial 1-866-KIDS TLC, and they are a referral site. So if you contact them, they will help you find childcare in your area. You can give them the information on exactly what it is you need. If you're looking for specifics, they can help you with that. If your child has accommodations that may be needed, they can help you find that specifically.
Okay, with that being said, Emily, is there a way that I can find a child care center that's near my home?
Yes, there is. You can still utilize the Childcare Aware number, and there's also a GPS map. I'm not sure if that's if that link is available. Catherine's
Yes.
putting it in the chat for you, but it's through the childcare layers, and it's for the city of Chesapeake. You can put in your zip code, and then you can also see which childcare centers are around you and utilize that, so they can see where they are specifically in that. And also with Childcare Aware, they also have the information on which centers are currently open and which ones are closed, and they can help you so that you're not contacting centers that may not be open at this time.
All right, thank you. Well, let me ask you this. What are the typical ages for child care services?
That's another thing that's center specific, but most centers, they can be licensed up to children ages 12 and 11 months. And they can go as young as 6 months or even younger than that. But most places typically between 2 and 12, and the oldest that they accept under the license standards, they can be 12 and 11 months. That's the guideline. Once they go past that age range, then they phase out of childcare.
All right, thank you. Now, Linda, I'd like to ask you, I know with the pandemic, many people were either furloughed, lost their job, or may have resigned due to health concerns. What is the typical cost of childcare, and can you break it down as it relates to full versus half-day programs?
Again, unfortunately, we can't give real specifics. Again, each child care program is different. Each city is a little bit different as far as what the state pays also. It's best to childcareva.com has a lot of information and resources that can help with that, or they are more than welcome to call our local Department of Social Services and we can assist as well as possible.
Okay, is there financial assistance available? And if so, how would one go about applying for that assistance?
We do have the subsidy program at Social Services, and you can apply online at www.commonhelp.virginia.gov, and that you can apply for all services from there, but you can apply for childcare from there. You can get a paper application from the agency if necessary also.
Okay, thank you, Linda. And let me ask you another question. How long does it typically take before someone can find out if they've been granted assistance?
We have 30 days to process an application, but our team is up and running and ready for what we need to do for back to school. We should hear from a worker within 48 hours. And as long as we can gather all the information, we can get it set up probably within a week at the most.
Okay, thank you, Linda.
Mm-hmm.
I know many child care centers require paperwork of various sorts. Emily, do child care centers require contracts? And if so, what are the typical terms of those contracts?
That's another thing that's kind of center specific. Some do require contracts, but in the registration period, you can also let them know, what their policy is and what they accept, because you may only need care for the first semesters because we're really not sure what's going on, and some may require to enroll for the whole year. But that's just one thing that I would discuss with them. And some of the contracts may include the hours of care, because some children may not be able to stay more than 10 hours or less than. But that's just one thing that you want to be sure when you're contacting the child care center, you ask them specifically, is this something that's flexible, or is this, laid in? And they can let you know, because some centers vary about what they require.
All right, thank you. Now, I know our parents will be going back to work in some sort of fashion, not, really sure about their hours. Are child care centers flexible as far as when they can drop off and pick up their child?
Yes, some of them are flexible. I'm sure Ms. Anderson can piggyback on that too as well. But that's just one thing. Some require certain cutoff times. And as long as you are open and have that discussion with them, then it shouldn't be an issue.
All right, Yvette, how does your drop off and pickup time work at your facility?
We have a staff member who mans the door in the morning to receive the children as parents drop them off. And then after a period of time, that staff member rotates into the center, and parents will come to the door, knock on the door, or sometimes they will call to let us know that they're there. And from that point, a staff member goes to the door and receives the child.
Nanette, do you want to chime in with your facility? Unmute yourself. You're muted.
All right, so for our facility, you can drop off up until 10 a.m. At 10 a.m., if the child has not arrived, then we consider the child absent unless there's been a phone call earlier in the day. We have children come directly to the classroom door, where we do a health check at the door before admitting the child.
All right, thank you. Emily, are there opportunities for parents to allow to visit child care centers and maybe have their kid visit for a day or two just to make sure that that facility is right for them? So sorry.
Some facilities are allowing that, but with the COVID restrictions, they aren't really having that many children come in. So some are doing virtual tours, meeting, greeting in that way. because they kind of want to limit the exposure of kids coming in unless they're enrolling, especially when you have a lot of parents and staff coming through. But I would just be on the lookout, because more places I've seen now, they've put virtual tours on their website, or if you contact them, most of the directors, they're able to Zoom or Skype with those that are looking, so they can kind of get a feel, just because you don't want to have as many people coming in and out of centers right now.
All right, thank you. And the next question, I think Yvette and Annette can possibly answer. I'd like to ask, respectively, since COVID, do you allow parents in the child care facilities, or is it just a drop off and pick up type of allowance that you allow your facility to use?
Well, currently, parents are not allowed inside our facility. They pick up and drop off at the door. And if there is a parent that needs a conference or wants a tour, then that is arranged after 5:30.
Okay.
Yes,
Annette?
and our policy is similar. Parents are not coming into the building. We're meeting them at the door. And if there's a discussion, I will step out and have a discussion outside with them, maintaining the 6-foot distance, or we will schedule something for the end of the day.
All right. Now, thank you. Linda, like we said before, we've got the pandemic going on. How should parents prepare their child as far as going to a new child care center, meeting with new people that they're not familiar with?
Well, that's a little difficult more now, since there isn't a lot of personal. I think a lot of good conversation, being able to do any type of videos, chat, so they can see the person is good. Reading any stories to the children about going to daycare or going to school to make it seem, feel more common and more normal. But a lot of conversation and support to the child, since there isn't going to be that, let's go walk through the classroom and look in the classroom, maybe helping them understand what to expect, what they'll see. If they can get any type of a schedule ahead of time to help share what that schedule would be, so that they're aware of like what comes next. But it's just a lot of support and conversation.
All right, thank you. This next question, either Catherine or Emily can ask. I'd like to ask you, since the school board recently announced a plan for virtual learning for at least the first 9 weeks, is there a current wait list for child care centers, especially with parents wanting to maybe just use it for the first 9 weeks purposes? And if there is a wait list, what should parents do so that they can get their child into a center? Catherine or Emily? Okay.
Oh, I'm sorry. So I know that there are some centers within our city that do have wait lists. I would encourage everybody to get on the wait list, but then also call other centers to find out where the availability is. And again, back to what Emily had said earlier, to call the 1-866 KIDS TLC number. Our child care centers are required to continue to let child care aware know if they're open or not.
All right, thank you. Next, we're going to move on to licensure. This question is for Trish. How can parents find out if a child care center is a licensed facility?
Good evening, everybody. Thanks for having me. Appreciate it. There are quite a few types of programs, types of child care providers out in the communities. And probably the quickest and best resource would be to go to our public website, the state website, which is www.dss.virginia.gov. And on that website, there are a bunch of headers. You would click on childcare, and there are drop-down boxes. You can pull up and put in specific localities. You can put in cities or counties and look for a list of the providers. They will show you whether they're licensed or unlicensed. There's different types of programs. You can look for family day homes, child day centers, or any religious exempt programs, things of that nature. And the really neat thing about this is it will give you a lot of information about a program. If you find a program you're interested in, you can click on it. It will give you a licensing inspector's name and contact information. It will also show you all of the inspections that have been done at that particular provider's location, and if there are any violations that have been cited. So it's a really, really good resource, and I really encourage people to use that. Also, you can contact our regional office if you have trouble locating that kind of information. And that I can give you that number if you like.
Sure, please.
Okay, it's our main licensing number. You can get to us through 757-985-4700 and leave a message, and someone will return your call and try to help you out.
Could you repeat that number one more time, just in case some people didn't get a chance to write it down?
Sure. It's the Eastern Regional Office. It's area code 757-985-4700. And there's a prompt to get to licensing on that, and you can just leave a message.
All right, thank you. And you may have kind of touched bases on this. What are typical requirements that, or general requirements that all child care facilities must have in order to be a licensed or be considered licensed?
Wow. That is also going to vary depending upon the type of program. Obviously, there are going to be different requirements for a family day home type of setting versus a child care setting. But in general, it's going to require a complete application, a fee. It's going to require some type of orientation training usually. Obviously, there are going to be background checks for the providers that are going to be required that they get, and references. We also ask for documents from their local government, such as a certificate of occupancy, or a contact with zoning form if it's a home situation. Sometimes there's a conditional use permit that's required by your city. Fire and health inspections, insurance information, floor plans, staff information, policies and procedures, all kinds of stuff is required. It is not a quick and easy process. I'm sure you can ask any provider out there, but we certainly do everything we can, especially during this time, to try and work with you and process those applications as quickly as we possibly can.
Thank you, Trish. And I'm sure that, you know, when parents go to these facilities, they can ask specific questions as related to their actual center. Thank you very much. Next, I'd like to ask, I know many parents want to know if learning of some sort will be taking place while their child's at child care center. Are the child care professionals licensed, meaning are they teachers? Do they receive some type of certification? Do they just need to have a high school diploma? What are the requirements?
Again, it's going to vary based on the type of program. You are going to see, generally, there are going to be minimum age requirements that are required in any program. Usually, there's going to be some type of education. The basic for a family day home basically is a high school diploma or equivalent. There are going to be specific requirements that are going to be asked for depending upon the position that the person has in the program. For example, a director is going to have certain requirements, minimum requirements for education, experience, things of that nature, versus a what we call a program leader, which would be like a teacher in a classroom, that type of thing. Everybody calls them a different thing. So it just depends on their role in terms of what the requirements are from the state. And a lot of child care providers will go above and beyond what the minimum requirements are. So as it's been stated earlier, the best thing to do is really to ask a lot of questions if you're looking for care, and to talk to the provider that you're considering, and try to ask them and get as much information about what they require of their staff and things of that nature. But there really isn't, I can't sit here and say that they're all licensed teachers or anything like that. There are certainly going to be some programs that will have some of those, but not all programs, and it's not required for a license for childcare in the state of Virginia. Let me think, is there anything else? I think that's pretty much covers it. You can go again to our public website. All of the standards for each of the programs is on there, and you can go and look up what the qualifications are for the different positions in those or the different programs.
Thank you. Nanette, do you want to chime in as far as what you require of your staff?
So it depends on the position as well. So for a teaching position in a preschool 4s classroom, we're looking for a staff member that has a CDA or a associate's or bachelor's degree in early education or elementary education. For, if we're looking at a 2-year-old classroom, we are looking for someone with a CDA or an associate's degree. But if somebody is in the process and has several years of experience working with that age group, we will supplement training with training for that classroom. If we have an assistant or an aide in a classroom, they don't necessarily have to have a CDA or a degree, but they do have to have at least 24 hours of training, and then ongoing annually 16 hours of training.
Okay, thank you very much.
Mm-hmm.
Okay, Catherine, at this time, we'd like to do a pulse check. And do you have any questions that we need to go over at this time?
I think the question, and I know that you were going to ask this in a bit about virtual learning and how that could be integrated within childcare centers, and if it will be.
Okay, we're going to answer that shortly. Are there any more?
Nope, everything else has been answered.
Okay, great. And parents, don't forget, viewers, don't forget that check our Q&A as Catherine is typing in different websites and telephone numbers for your reference. All right, this next question is for Yvette and Nanette. We know that parents are ultimately responsible for their child's academic success. However, with the recent changes to children learning virtually, will there be an instructor to supervise and assist children during virtual learning? And is this a typical decision made by individual childcare facilities, or is this something that's global?
I think that this is something that is made by individual centers. In the springtime, there were centers that had dedicated staff members who helped with the virtual learning. And then there were those in which the parents did the virtual learning at home and maybe brought the children later on. So I really think it depends on the individual center and how the staff is going to be utilized. For my particular center, we are trying to work with the families, because many of our families don't have the jobs in which they can work with the children during the day and then go to work. So what we did during the spring, we got the learning packets and work with the students. We are working on a plan now for to have a staff member that's dedicated to doing some of the virtual learning. So, but again, it depends on that individual center.
Yes, I agree. It depends on the individual center and what they're able to support. So, and again, some parents are able to work on the remote learning at home and then bring their child in and go to work. What we're doing is we're going to support the remote learning as much as we possibly can. We are breaking our school age group down into different age groups, and we have a staff member that is overseeing each age group, and they will be helping the child with the remote learning and keeping them on task and communicating with parents at pickup of where they're at and what additional information the child, what additional work the child needs to work on, or areas that need to be shared with the parent.
All right, thank you, ladies. Emily, some families may need temporary childcare. What happens if a parent only needs childcare during the virtual learning process? For example, maybe only the first 9 weeks. How does that process work?
That kind of goes back to when we're discussing like with contracts and just discussing when you are interviewing and talking to the centers, because you may just need it for a short term, or it may also be that you only need assistance for certain hours of the day because they may have their classes, where they do them virtually from 10 to 2 and you only need that type of care. Some places do allow what's considered like drop-in care. So I would just be sure to ask if that's something that they provide. Do they offer drop-in care? Because they may have depending upon how they have their school age groups set up, that may be something they're able to provide and offer, especially now with everything going on with COVID, the numbers are reduced. So there's not going to be a lot of children in the classroom. and they can offer some guidance with that.
All right, thank you. Again, Emily or Linda can answer this next one. Will children have access to Wi-Fi to complete virtual learning learning activities while attending centers?
It's a possibility. But it's another thing that I will be sure to ask the centers, because some of the centers in the city that I've spoken with, they do have Wi-Fi, and some that don't necessarily have Wi-Fi, they have computers set up where the children can go and access that learning, where they're like hardwired into the internet. So that's just something that I would just contact them directly to see, because I know, everybody right now is kind of up in arms because it's kind of short notice. So they're trying to work faster to equip and to accommodate, because some of the childcare facilities, they may offer summer camps, but now during the school year, it's not necessarily routine what they would have had through the day. So they're just working to accommodate the families and just to make sure that the children are still able to access those classes and things during the day, because I know it's frustrating, especially with parents, everything going on now, where if your child's in childcare and then if you're not able to get the schoolwork done during the day, then you kind of feel like you're catching up in the afternoon. But that's just one thing where I would just discuss with them to see, what do they have in plan, or they may be in the process of working that out. So that's just a question I would ask them specifically.
All right, thank you. Linda, did you want to chime in or anything, or you're good?
No, I totally agree.
Okay, great. Many families have requested programs for students in middle school and early high school. So today I received information that Believers Church has decided to open up a study hall for students in grades 6 through 10. Currently, the locations are only at Jollop and Western Branch, Western Branch Middle and High. The cost is $100 a week. However, they are offering partial scholarships. So for more information, you have to contact believerschurch.org, and that will be starting Monday, August 10th. Again, that's believerschurch.org for additional information. Additionally, Hickory United Methodist is also offering half and full day programs where they will allow students to learn virtually. They'll have staff on board to help your child learn during the virtual process. The cost will be $40 a week with no contract. And again, this includes virtual assistance. So for more information, please contact 757-692-1350. Emily, so we do have students with exceptional abilities. If a child is an exceptional learner and there child care centers that are equipped to handle his or her abilities, and how do they address behavioral concerns related to their abilities?
There are child care facilities that are able to, assist with exceptional learners. I know specifically one place that I would contact is Childcare Aware. With that referral line, when you contact them, you can let them know like what specific are your needs. You want to open up the conversation as well when you're discussing with the center, just to see and disclose, because they may have certain needs that the center's not equipped to handle. And they may need certain accommodations where you may just need to give them time so that the center can adjust, say if the child were, even if it was something as simple as a wheelchair, that's something that they could possibly accommodate. But they just need time to know, as well as even if you have a child that may be on medication or needs some type of medication, you want to make sure that when you're contacting the center, that you make sure that they have somebody who is able to administer medication. You may see somewhere if somebody refers to it as a MAT certification or a MAT training. That's simply just meaning that they are able to administer medication. It's something you want to ask, because especially now if they have asthma, you want to go through that process, because centers do that routinely. They are MAT trained and certified, and you want to be able to provide like an emergency inhaler and your asthma action plan to the school. So they are aware of what the doctor requires and what you require, and you just want to have that discussion so everything is able to go as smoothly as possible.
Thank you. Leonis, I'd like to ask you, can you provide more insight on child care facilities' legal requirements as it pertains to IEPs? Are they required to provide services? How does that work?
Okay, simply put, child care facilities are not required to follow IEPs because they are a private industry, and so they're not receiving any public funding, so they don't have to follow that. So it's really important that you research the child care that you want to go into and find out if they are willing to take your child that has special needs, and what can they handle and what can they provide. So that's an important question to ask.
Thank you very, very much. Again, Catherine, at this time, we're going to do a pulse check. Are we good? All right, we're going to keep moving on. Let's talk about the health and safety conditions of child care centers. Yvette, what measures are child care centers, particularly in reference to yours, putting into place to prevent the spread of the COVID virus and more?
First of all, we make sure that all the children and staff members wear their mask at all times. We also make sure that there are enough materials and centers available that the children can socially distance. And when I say enough materials, it could be something like making individual slime. And so when it's time to play, you have your own individual bag of materials. We're constantly washing hands, and we make sure that the children are constantly washing their hands as well. We sanitize everything. It's whether it's tables, the handles, anything that children touch, we're sanitizing. Even the iPads and tablets that the center has, we're sanitizing them on a regular basis. We just make sure we are socially distancing at all times.
Thank you. The next question, I'd like to ask Linda first, and then Lisa. Linda from the child care supervisor perspective, and then Lisa from the healthcare professional standpoint. What measures should be in place to ensure children aren't getting sick at these facilities?
There are specific measures that everyone is required as far as their cleaning, their social distancing, following the CDC regulations. I would want parents and help parents to understand that a daycare provider can't guarantee a child won't get sick. But I know that every child care provider I know, and I was a child care provider when my children were little, I wouldn't want them sick at any time. So especially during these times, they're going to do their best to keep the children safe, their employees safe, but mostly following the CDC guidelines.
Thank you. Lisa?
What I want to make sure everybody understands is that many children, especially children, but adults too, can have a variety of symptoms, and they may be asymptomatic and be able to spread the virus. So I want you to keep that in mind, and there's no guarantee that your child is not going to get sick, especially if they're exposed to an asymptomatic carrier. So I just want everybody to understand that there is asymptomatic transmission out there.
All right, thank you. Yvette and Nanette, let me ask you, are kids able to social distance while being supervised? And if not, what measures are you putting into place to make sure that kids are not near one another during different activities?
I think it really has a lot to do with how you're planning the activities. So if you're planning to do a yoga activity, you already know that you have to place the children, space them accordingly. I also think that with the younger children, it is a lot harder because they like to be with their friends, or they like to play with the toys that their friends are playing with. So you have to make sure that you have a variety of materials out at all times. So when you see a child that's going in the space of another child versus making that child feel that they can't play with that, you make sure that you say, oh, here's another option. How about playing with this puzzle? So you make sure that it's something that the children are enjoying and that they don't mind not playing with another child or not playing in a particular center because you've offered some other options for them.
All right, thank you. Nanette, you want to chime in?
I agree. And it does depend on the age group. Little ones, toddlers are a little harder to social distance. We do our best, and we are encouraging activities. We divide into smaller groups and do activities where we're spreading out a little bit more. In your preschool 3s classrooms or 4s classrooms, we'll have a carpet area with tape dividing the carpet area, and we'll have multiple sets of magnetics or Legos or manipulatives where, you know, we can both be playing with the same, maybe the same type of manipulative, and we're playing generally in the same area, but we're not up close to each other. We're not sharing those manipulatives. We have our own set.
All right, thank you. Lisa, do you want to chime in with that? Are you good?
I'm good. I mean, yeah, I'm good.
Okay. Do you, and this is in reference to, I guess, one of the childcare providers, are you requiring children to wear a mask? Are there certain age groups that are required? How are you handling the mask? You can do Yvette or Nanette. It doesn't matter, either one.
I'm sorry, hold on.
That's okay.
I missed it, hold on. For me, I am with the exception of the 2-year-olds, everyone is required to wear a mask.
Okay. Nanette, what about temperature taking? Are you guys taking temperatures of everyone?
So yes, all temperatures of staff and children are taken at the door before signing in, and anyone with a temperature of 100.4 or higher is not allowed in. And even if a child or a staff member has a lower grade temperature, we're asking questions and monitoring as well. We might have them wait for a few moments and take the temperature again, especially right now as it's so warm outside, you know, just coming from your car to the door, you know, you'll get a 99.4. So,
Right.
you know, we will reassess.
All right, thank you. Lisa, I'd like to pose the following question to you. And also, of course, Nanette and Yvette and even Trish, you might want to chime in. In case of a COVID outbreak, will the center be closed? How will parents be notified? What's the process? We'll start with you, Lisa, first.
Okay, I want to explain 2 different things. There may be an exposure that requires kids to be sent home too, meaning that they were exposed in like a classroom and they have to be quarantined, okay? We do not call that an outbreak. Many people want to say that's an outbreak because the kids were excluded, but that's not necessarily true. In the case of an outbreak, it also may just involve a classroom. It doesn't necessarily have to involve the whole school, but if it does, it can. I mean, it depends on the exposure that's happened with the children that are causing, you know, that have this outbreak happen. So if all the children and all the staff are exposed, then they would have to be, the school would have to be closed, but only if there's a need to exclude everyone, okay? And parents will be notified. I mean, when there's an outbreak, usually the health department likes to work with the daycare center and provide a letter jointly between the daycare center and the health department to explain what symptoms to look for and to explain exactly what happened, that their child was exposed to somebody in their class, somebody in the school. But the health department will not contact all the kids that are exposed. That will be the job of the daycare center about the quarantine and or exposure for the outbreak. But the ones that are ill, the health department will contact those parents.
All right. Yvette, do you want to chime in? Or Nanette, do you want to chime in and tell us how you all handle situations within your facility?
Well, right now we've been very fortunate that we have not had any issues, but we would definitely seek the help of the health department in these situations.
And it is a required reportable thing to do. So you don't have to call for every child that is sick, but you have to call if there's an exposure, or not really even an exposure, an outbreak in a facility.
So if there's a question of whether or not there's an exposure, you know, we're going to call the health department. That's going to be the first call to get guidance as far as, you know, what we should do as a center, if it's just in the classroom, if it's a contact to contact type of exposure. So we will get guidance from the health department on how to go forward in whether or not we need to just send some children home for a quarantine, or close a classroom, close 2 classrooms, or if we need to close the center.
Okay, thank you. Now, Lisa, we talked about where can families find more information about the guidelines from the health department. And I know that you sent me a slide. Do you want me to share that slide with everyone?
Sure.
Okay, let's see here. Right here. Okay, Lisa, you want to go ahead and talk about it a little bit?
Though that is the graphic for isolation and quarantine, and telling you exactly what you need to do and when you can go back after either isolation or quarantine. Isolation is having a sick person stay away from anybody that could be well. Quarantine is having somebody exposed that's not yet sick stay home and away from others in a quarantine environment, so they don't expose others in case they get sick. And that's the guidance on that. You can get that on vdh.virginia.gov. That has all kinds of information for parents as far as what we require for any exposure.
All right, thank you. And families, we will have that available for you as well. In relation to quarantine guidelines, especially with travel, how do you handle that? Lisa, how would parents handle, like, if they decided that they want to take a trip to Disney World and then come back to the childcare center? How should childcare centers handle that?
On another website that I think it was made available to you guys, it's cdc.gov. It's the Centers for Disease Control, and they have a whole section on COVID and travel and where are high-risk areas. The United States is considered a high-risk area. We're told, people in other countries are told not to travel here as well. But there's a whole, if you go on there, you'll be surprised at how many countries they do not want you to travel to. They don't necessarily say you have to quarantine when you come back, but that could be an option if a provider is concerned or some situation comes up in the future that we do not want people to travel. Just like I think, for instance, one was South Carolina. I think you guys heard about that. We were asking people that came from Myrtle Beach in South Carolina to quarantine for 14 days when they came back because there was a big issue going on there. So there may be instances like that pop up. You can find that on cdc.gov and under COVID, and it talks about the travel.
All right, thank you. And when should parents keep their children or child home if they suspect that they're ill? And at what point do they need to contact a health professional?
All right. The symptoms for COVID are broad. Okay, it's almost everything that your child can have: fever and chills, cough, shortness of breath, fatigue, muscle, body aches, headache, a new loss of taste or smell. That is very individualized for strictly COVID. These other things can be other things, but COVID is the only illness we've ever had that has a new loss of taste or smell. So that's very significant if anybody loses that ability to taste or smell. Sore throat, congestion. I know people have allergies. Congestion or runny nose, nausea or vomiting, or diarrhea. They should probably talk to their doctor, stay home, and talk to their doctor. If there is a reason, like say your child has allergies and you know for sure it's allergies, that is not a reason to keep your child home, but you might want to consult with the doctor if you think it could be COVID, all right? And we want you to call your doctor before you go in. CDC and VDH on our websites, those vdh.virginia.gov and cdc.gov, have a self-checker. They actually have a link you can go in and put in your symptoms, and it will tell you what you should do and where you can go. It will also offer places for testing. Okay, everyone that has COVID does not necessarily need a test. Okay, we recently had I know somebody personally that had a loss of taste or smell. It was a healthcare worker, and they did not even require that she get a test because there was no reason. That's significant for COVID. So your doctor may not even require that you have a test. They may just say, stay home. You need to seek emergency care, however, if anybody is having trouble breathing, there's persistent or pressure in your chest, confusion, inability to wake up or stay awake, your lips or face are bluish, and you want to call 911 ahead or call your emergency room ahead and say what you're experiencing before you go in there, because you do not want to expose anybody.
All right, thank you. That's great information, Lisa. Thank you very much. Emily, some parents have expressed concern regarding personal health conditions that are not particularly related to COVID. What if a child has underlying health conditions such as asthma, nut allergies, etc.? Are child care centers equipped to handle these things? And what are the medication guidelines and as relation to meals? Are parents required to bring meals or bring their lunch to the program, or are the programs providing the lunch for the kids?
Well, that's one thing, kind of going back to when I discussed the MAT training. You want to make sure that you discuss with the centers, the type of training, if they're able to administer medication or not. And also most centers it's a requirement, it's a part of the enrollment package that you list, any type of allergies or food or health issue that they may have so that they can accommodate you. One thing with food, some places participate in the acronym of CACFP, basically just the shorthand for the Child and Adult Child Food Care Program. And with that, basically, the center provides the foods for them, and they can make the accommodations based upon what they have. So if you let them know right offhand, my child has a nut allergy, some places are specifically nut-free. So you already, are aware of that, and they can make those accommodations. I know I've worked with some centers before when they had a child that was not able to drink milk, but one of the requirements, the parent just brought in an equivalent milk because they were in the food program. So it's just open to that. Some places now with COVID, some aren't allowing parents to bring food in just because they're limiting, exposure from outside food, and they're preparing food on hand, but some places are. So it's just one thing you want to discuss with them to see, because food, it varies center by center. So it could be something that's included. I know Ms. Anderson may be able to add on this, like at Right Start, the food is included in the cost. For the children come, they receive breakfast, a morning snack, lunch, and an afternoon snack. And that's a part of being in that food program that a lot of centers in the city do participate in. And they're able to accommodate those children that may have a nut allergy, or they may have a food sensitivity. And also when you get into those other health conditions, they're also able to assist because they've been through that MAT training, so they can administer the medication and help them when they're in need.
All right, thank you very much, Emily. Catherine, doing another pulse check. Are we good? We're good. Okay, good. So the next thing I'd like to do, and we're nearing the end, and I'd like to share my screen again. I have a few websites that may be beneficial. Let's see here. All right, here we go. For some reason, it didn't want to. All right. So the first website that we have, and Catherine already put this in our chat box, is the Childcare Aware. This is the number and the contact, as well as the email address if you'd like to visit them on the web. The other facility we have is the Childcare application, and this is through the Department of Social Services. That's the link for this. Again, parents, if you want to take a screenshot or take a camera picture, you can do that. I will also have this available on YouTube within a week. Licensing Information Department of Social Services, that's www.dssvirginia.gov. Again, we mentioned that before. And then the Child Care Map, I transferred that into a bit.ly, so if you need to have more information about childcare and their locations, you can visit that site as well. The next thing from the health department, we have one site, Symptoms for Exclusion. This is the site if you need to know more information about that. Community Work in School, the cdc.gov, and then childcare camps with the Virginia Health Department. That's the website there that you can also go to. And then the last but not least, this is our contact information, the Office of Family and Community Engagement. My name, Lisa.Kerry, along with my partner, LaEunice Brown. And then we also have from Chesapeake Human Services, Catherine Jesse, Linda Ross, and Emily Edmonds. And you can also contact them if you have any questions related to child care. At this time, are we still good with questions? One. Okay, we have one.
There was a question that I'd like to ask Linda, if she could talk about what is required when someone is applying for child care assistance.
Right. To be eligible for child care assistance, we need to be the biological parent or caregiver of the child. We need to be a resident of Chesapeake, working or in school, become income eligible, and cooperate with Department of Child Support Enforcement. Information you might need to have on hand to bring in would be birth certificates, personal ID, last 3 paycheck stubs, and shot records. And your worker will get with you within a few days and also send you a checklist of information and work with you to get that information gathered as quickly as possible.
Thanks, Linda. Are we good, Catherine? All right, great. Well, this concludes our presentation. Again, as stated before, we will upload this to our Chesapeake YouTube channel for future references. Additionally, you can reach us at Eunice and I at the Office of Family and Community Engagement. That number is 757-482-5923. Again, 757-482-5923. And again, I thank you all for participating. I thank my panelists for participating. Again, I want you all to know that we are all in this together. We are all going to get through this together, and it's going to be all right for all of us. I wish everyone a great evening, and thank you for attending.